This semester is always out of sync because everybody's labs are the same. Everyone's. We do the same thing during the same week. It's more, yeah. It comes out of sync in the semester because we have to spend a certain amount of time on the skeletal system, and then we have to spend a big bulk of time on the nervous system in lecture. So, well, that's, hate to be a nasty one, but that's life, kid. So it'd be like taking, it's like taking 2 classes, You already know all the stuff you need to know for lecture, for lab. Now what's going to happen is you'll already know everything you need to know for your next lab. So that's not a bad thing. It's worse when you don't know what you're doing in lab. Believe me. Okay, my friends, let us hopefully finish. Wouldn't that be exciting? Chapter 13 today. So we left off talking about cranial nerves. How many cranial nerves? 12 of them. And you have to know them by what? Name and number. And, what they do for a living. Right? What's your first cranial nerve called? Olfactory. What's it do for a living? Sense of smell. Yes? Number 2? Optic. Sight. Yes? So you can see me. Okay? So that for all 12. Now, optic and olfactory have neuron cell bodies within what we call special sense organs. Where are the olfactory and optic nerves cell bodies located? Olfactory would be what? Yeah. Nasal epithelium, not in your nose. Yeah, up above in the nasal epithelium. If I pulled your nose off, could you still smell? Yes. What's your nose for? Filtering. Yeah, it helps to filter, it helps to warm, and it helps to direct air up to that nasal epithelial region. It's also a nice place to hang your glasses. Yes? Comes in handy. Optic. Eyeballs, yes. So other nerves with sensory information, 5, 7, 9, and 10. These neuron cell bodies are in cranial sensory ganglia, groups of cell bodies. Don't get too crazy about that. I'm not too worried about that. I'm also not too worried about you knowing which ones are sensory or motor or both. But there's a really quick little saying that helps you remember which cranial nerves are which. So cranial nerve 1 is what? Sensory. Cranial nerve 2, sensory. 3, motor. You getting the point? And that little thing down there is going to help you remember that. I probably won't ask you a question on the test about that. So how many pairs of spinal nerves do we have? And what are spinal nerves? Nerves that feed into and out of the spine. 31 pairs of spinal nerves. How many vertebrae do you have? So you have 7 plus 12, that's 19, plus 5 is 24, and then you have a sacrum, and you got a coccyx. Okay? 31. Well, here's where some numbers come in that you sort of learned when you memorized the bones. How many cervical vertebrae do you have? 7. How come there's 8 cervical spinal nerves? Yeah, 1 on the top and 1 on the bottom. Then all the rest will follow suit. There's 12 thoracic. There's 5 lumbar. Why is there 5 sacral? Remember the little bones? The sacrum was made of 5 bones, had all those holes all over the place. 5 sacral. And how many coccyxes do you have? 1. The coccyx was 4 fused bones, yes, but unfortunately you don't have 4 coccygeal nerves, so it doesn't follow that one. So, 7 cervical vertebrae, 8 pairs of cervical spinal nerves, 7 exit vertebral canal superior, 2 vertebra or vertebrae, for which they are named. So, they have similar names to the vertebrae. We can number the vertebrae C1 through C7. We also call the first and second one something. What's the first vertebrae called? Atlas. What's the second one called? Axis. And then 1 exit canal inferior to C7. So, take out your clicker. I know, we haven't used our poor little clickers in a while. I know, they get a little dusty during this unit. Okay, question. What are stimulated when sound waves vibrate hair cells in the inner ear? You're assuming correctly. Only 32 today? Well, 32 with their clicker. 5, 4, 3, 2. What's the answer? Sound is a mechanical sense, mechanoreceptors. Ooh. No, we don't hear pain. Unless the radio is really loud, right? What's a nociceptor? Pain receptor. At which level of the somatosensory system are conscious decisions made about low-grade touch stimuli? Five, 4, 3, 2, 1. Where'd number 33 go? To the bathroom? I don't know. What's the answer? Good. The receptor level is doing what? It's just receiving information. You don't make any decisions until you hit the file cabinets, right? You have to go get files. So, when we look at spinal nerves, they are again named for the region in which they enter the spinal cord. So we have a group of nerves in the cervical region, and they are called cervical and brachial plexuses. A whole bunch of things feed in that region, so we see a larger portion in the cervical region called the cervical enlargement. Then we have intercostals running in through the thoracic region, T1 through T12. Then again we have groups of nerves in the lumbar region, sacral region, lumbar plexuses, sacral plexuses, and then we have kind of endings from the bottom stuff that create what? What's those nerves feeding into the bottom of the spinal column? They form something that looks like a horse's tail. What's it called? The cauda equina. So, each of the spinal nerves connect to spinal cord via two roots. Similar to what we talked about when we talked about the gray matter horns in the spinal cord, we had two sides. We had ventral and we had dorsal, front and back. Dorsal was what? Dorsal was what? No, back. What was it for? Dorsal was what? Sensory, very good. And ventral is what? Motor. Same thing applies here. Remember, these are the splits that are going to come into the spinal cord. So we're going to see a nerve, and do you remember what a nerve was? A whole bunch of neurons, right? We're going to split so that we can enter the spinal cord and start sending information for processing in the cerebral cortex. So each spinal nerve connects to the spinal cord via two roots. The ventral root is carrying what? Motor. And motor is going to do what? Where's motor going? It's going from central nervous system out to peripheral nervous system. Dorsal is sensory. So sensory information coming in is going to branch off and go dorsally through the spinal cord. Dorsal and ventral roots unite to form spinal nerves, which emerge from the vertebral column via the intervertebral foramina. What the heck is an intervertebral foramina? Holes. Yes? So when we look at this diagram that we see on page 502 in our textbook, we see some of the pathways spinal nerves take to and from the spinal cord. What's that big honking bone there in the front? That's a vertebrae. What part of the vertebrae is that? That's the body of the vertebrae. Very good. You have a test coming up. You should know that stuff. Okay, so rami, groups. Ganglia, groups. Same thing. Each branch are mixed. So when we look at the branches, dorsal and ventral, we see there's groups of different neurons running in different directions. Dorsal ramus, ventral ramus, which tends to be on the larger side. And then we have a little branch called the meningeal branch. And what is the meningeal branch doing? What's a meninges? It's the covering of the central nervous system, right? There's three of them, aren't there? What are the three called? Duramata and arachnoid. Not in that order, though, right? Who's in the middle? Arachnoid's in the middle, yes? So tiny re-enters vertebral column, innervates meninges, and helps with some blood vessel innervation. And then we have a group of rami called the communicantes. Those are autonomic pathways. What's an autonomic pathway? Things that happen automatically, things we don't have to think of, are in these little groups. So all the ventral rami except for T2 through T12 form interlacing nerve networks called nerve plexuses. So rami, plexuses, groups. We have a group in the cervical region called the cervical plexus. We have a group in the brachial region. What's brachial? Point to brachial. Yeah, up in here, coming in this way, called the brachial plexus. Lumbar, point to lumbar. Lumbar plexus and sacral plexus. So the back is innervated by dorsal rami via several different branches. We have ventral rami, T2 through T12, and that's all the stuff in the middle, intercostal, ribs, muscles. That's going to help with abdominal wall, upper abdominal wall. Spinal roots, longer. That's a weird sentence. Spinal roots longer as move inferiorly in cord. The lumbar and the sacral roots extend down the tail, the cauda equina. Again, I'm kind of reading from this because that's exactly what I want you to know. So, plexuses are going to crisscross. This is why nerves are what? Or neurons, I should say. Myelinated. Because we get a lot of crisscross in this region. Any damage to anything that's coming from those lower regions, from those lower limbs, is going to cause paralysis. When we have a peek at the bottom of the diagram on page 502, we see some of the branches. Now, this is an intercostal nerve, so where do you think we're talking about? Intercostal would be where? Yeah, in the rib region, in the what? Thoracic region. So this is a cross-section of the thorax, showing a main root and branch of a spinal nerve. Again, we have to innervate different muscle groups in this region, both in the back and on the sides. Those are all going to help with what? Why do those muscles contract in the thoracic region? Breathing. So when you first enter a movie theater, the smell of popcorn overwhelms you. Once the movie's ended, however, you don't even notice the popcorn smell. You have experienced what? Yep, clicker again. Oh, 34 now. Five, 4, 3, 2. What's the answer? I think it's adaptation. You are right. Oops. Pretty good. All right. So basically the next part of your notes talks about some of these major plexuses. I just want you to have an idea of where they are and generally what information is going into them. So cervical plexus, groups of nerves formed by an area called the ventral rami. Again, groups coming into the spinal cord, C1 through C4. What's that? Yeah, we're talking about the cervical spine, and we're talking about where they enter the spinal cord. And where are these guys going to help with? What areas? Skin, neck, ear, back of head, shoulders. Other branches are going to innervate those neck muscles. Most of the branches here are going to form what we call cutaneous nerves. What's cutaneous? Skin. The phrenic nerve, motor and sensory nerve of the what? Diaphragm. What's that going to help us do? Yeah, also, if I irritate it, what's it going to make me do? Hiccup. So hiccups are actually an irritation of the phrenic nerve. Did you know that? Yeah, see, when you get asked that on Jeopardy now, you'll impress Alex Trebek, because you know that now. There you go. So this diagram shows us those guys and some of the branches, or tangles it kind of looks like, doesn't it? This diagram talks about the branches of the cervical group. So again, in general, what cervical plexus is, understand the areas it innervates or is responsible for getting information to and from. And it kind of makes sense, doesn't it? It's not something you're going to have to sit and really memorize a lot, because where is the cervical vertebrae? In the neck and the head region. The only one you'll have to kind of remember is phrenic nerve and diaphragm. Yes? Brachial plexus, where's that? Point to brachial, because you already know brachial, right? Where's brachial? Yeah, there you go. See, remember those words I told you had to memorize? Why? So, brachial is upper limb. Again, formed ventral rami, C5 through C8. So the lower part, you know where that little cervical enlargement is? That's why there's a cervical enlargement there, because of all these guys feeding into the bottom. And then also incorporates T1. Often, again, we're not all wired the same. Sometimes it can incorporate C4 and T2 as well. Upper limbs. So when we talk brachial plexus, think upper limbs. There's 5 different branches. There's roots, there's trunks, divisions, cords. Don't worry about that. Yes, sir? No, we're talking about spinal nerves. Not vertebrae. Yes. Good pickup, though. So there's anterior, front, and back. There's side. There's middle. Don't worry about it. Just remember brachial plexus and upper limbs. And we see a picture of these guys. I hope as we go through this, even though I don't make you memorize a lot of this stuff, and again, you might someday have to memorize a lot of this stuff depending on what you choose to do after you leave Central Maine Community College, but I hope you have an appreciation for how complex we are wired. You know, don't take anything for granted. You know, amazing how you're wired. How'd that happen? So, again, this you don't have to memorize, but this is where some of the information is going with respect to the brachial plexus. Some of the important nerves associated with the brachial plexus are the axillary. These I'd like you to know only because you're going to hear them again, especially if you go into a clinical setting. You hear these a lot. If you work in a lab, a clinical lab, you're going to hear these a lot. So, axillary, that's going to innervate some of the upper shoulder, musculocutaneous, biceps, and we're going to talk about these guys when we talk muscles, again in the upper arms, the median skin, flexor muscles. What's a flexor muscle? I'm going to kind of teach you some muscles. Ones that do what? Shorten. So most of the flexor muscles in the forearm, pronators, supinators, you know those, right? Because they're going to be on your exam in lab, so you better know that. Pronate, supinate, yes. So there's different innervations from different groups to contract different muscles to make those moves. When I go like this, I'm going to use a different group of muscles than when I go like this. Okay? So wrist, fingers, flexor thumb, that's what allows us to be the amazing things that we are, humans, because we can do what? We have opposition in the thumb muscle. Amazing. We also have a group called the ulnar. And where's the ulnar? Yeah, lower radius and ulna. Yes, radius, ulna. So innervate some of those muscles in the lower arm. Those are going to allow us to actually move our hands like this as well. So when you move your hands like this, do you feel anything up here? Yeah. What's causing your hands to move? Innervation from the lower arm. And then radial, innervates essential all extensor muscles, supinators, and posterior skin of the limbs. So, just a quick understanding that those are part of the brachial plexus and what they innervate. We see those guys in the upper limbs. All right, lumbar. Lumbar is where? Oh, by the way, here's a table on page 505 in your textbook that puts them all in perspective. Again, you don't have to memorize that. Oh, let's use our clicker again. I know you keep putting it away. Jeez, I'm getting off to exercise with the clicker today. Which cranial nerve is the exception and travels to the thoracic and abdominal cavities? What was that number? 30-something? 35? Do you remember? Five, 4, 3, 2, 1. What's the answer? The vagus nerve. Well, we kind of said, you go off to Vegas, and what happens in Vegas stays in Vegas. See? Maria's she didn't say this stuff for no reason. So yeah, vagus. Everybody else is more associated, for the most part, associated with things that are going on in the head. So, lumbar. Where's lumbar? Innervates thighs, abdominal wall. What's a psoas muscle? To the kneecap. Femoral nerve. Femoral. You've probably heard this on all the shows that you watch on TV. CSI. Bones mentioned the femoral nerve the other day during one of her important cases. Where's the femur? Femoral nerve. Innervates quadriceps, skin of anterior thigh, medial surface of leg. Obturator. What the heck is that? What's adduction? We're talking lower limbs. Yep. Towards, not away. Yeah, decreasing the angle. Very good. So we see the obturator there in the lumbar region. Again, this one, know the lower limbs. You should be familiar with those terms and know that they're in the lumbar plexus. Again, I'm not going to make you memorize what they do. Sacral, L4 through S4, butt region, lower limbs, pelvic structures, perineum. Sciatic nerve. Anybody have any experiences with the sciatic nerve? That's one of the longest of the nerves. Remember when I described to you in the beginning when we first started talking about neurons? I said sometimes we can have neurons that start in one place and go all the way down and end at a totally different area. Well, this is the longest and thickest nerve in your body. It starts up in the lumbar sacral region and runs all the way down where? All the way down to your heel. Innervates hamstring muscles, adductor magnus, and most muscles of the leg and foot. There's two branches of the sciatic nerve, the tibial and the common fibular. The tibia and the fibula. See, they're all, this one's not as bad because you already know all the bones, right? So aren't you grateful that you know all the bones already? You're so grateful. I can see the gratefulness in your face. So we see this diagram on page 507 in your text. And that's pretty long a group. The plantar branch might cause some problems. Some of you who aggravate the plantar branch might have something called plantar fasciitis. You ever hear of that? Well, what's a fascia? It's not a muscle. It's a covering that kind of holds a couple together, and that's where this. Yeah. When you get a steak, you want to get rid of that because it's really tough and you'll be chewing on it for about a year or two. Yeah. That's fascia. No, gristle is fat. Fascia is different. Yes? Well, gristle's fat, right? Yeah. Fascia is tough. So when next time you get a steak and you cut out that tough piece, or chicken, you ever get a chicken breast and you have that one little white piece that annoys the crap out of you, you got to pull it out, that's fascia. Yes? So we see this table describing some of those guys. The anterolateral thoracic and abdominal wall are also innervated by different groups. Thoracic region. Don't worry about the details there. In your textbook, they talk about some of the different areas that these groups of spinal nerves innervate. And they've created what we call a map, or dermatome map. Anybody ever have surgery? Did you ever see this before? While you're waiting to get your anesthesia? They're usually on every wall in every anesthesia region of every hospital. You weren't awake for your surgery. Huh? This is a map of the innervation regions of these spinal nerves. So when I give you anesthesia, it would be nice if I block some of the nerves that are innervating some of the areas in which I'm going to cut into on you. Yes? Yes. So that's why this map is very important. So it's called the dermatome map, and it's the area of skin innervated by cutaneous branches of spinal nerves. Remember, cutaneous means what? Skin. So another name for the integumentary system is the cutaneous system. So all spinal nerves except for C1 participate in the map. C1's way up in the brain region. So if you're having brain surgery, we might talk C1, but we're not going to talk about that when we talk about skin. So these are some of the different groups of nerves that innervate the different regions of your body. And very important when you're giving somebody anesthesia to block that region. Innervation of joints. What are synovial joints? Those are freely moving joints. They contain what? Synovial fluid. They have some ligaments on the outside. They have synovial membrane that makes the synovial fluid. There's articular cartilage there. So when we talk about innervation of joints, a law called Hilton's law comes into play. And that's any nerve serving a muscle that produces movement at a joint is also considered innervating what? A joint. And typically the skin over the joint. What's a peripheral motor ending? Peripheral is where? Outside the central nervous system. Peripheral elements that activate effectors by releasing neurotransmitters. So what effect can I have with the peripheral nervous system? This is most of what it does. Causes what to happen? Releases a chemical, causes something to happen. Action by what? Potential. What's it innervate? Peripheral nervous system. Innervates what? Muscles to contract, exactly. So muscles to contract or what? What else? Why do we need a nervous system? According to you guys, we don't need it. It's going to cause muscles to contract or... No, that's muscles to contract. It's going to do something else. What else helps to control bodily functions besides the nervous system? Chemicals. What kind of chemicals? Hormones. What system takes care of the hormones for us? Endocrine system. Very good. So the nervous system also innervates the endocrine system. So review of innervation of skeletal muscle. Review because in the book they cover muscles first. But in our class we didn't cover muscles first. Which is kind of good because we really should know how nerves work before we cover muscles. This is review. It's not review. We haven't covered it yet. But we're going to cover it when we cover muscle physiology, which is coming up sooner than you think. When we talk about communication between muscle and neuron, it's very similar to the communication we discussed when we talked about communication between neuron and neuron. How does one neuron communicate with another neuron? It releases a chemical. What's the name of the chemical? Neurotransmitter. In respect to the nervous system's communication with muscular system, the specific neurotransmitter we're going to talk about is acetylcholine. Remember, that's not the only neurotransmitter, right? There's a whole bunch of them, right? So acetylcholine is going to be released from a neuron into a synapse. It's going to diffuse across the space and come in contact with the receptor for acetylcholine on the muscle. You with me? Then it's going to cause a change. Very similar change to what we saw when the neuron communicated with the neuron. What's going to rush in to the muscle cell? Sodium. Because we have an effect on the sodium-potassium pump. The same type of change, electrical change, is going to happen within a muscle cell. So when muscles contract, can I measure that electrical change on a machine? Yeah. Anybody ever have an EMG? What's it called? Electromyogram. Yes, myomuscle. So you can measure that electrical change just like you can measure it in a neuron happening as well. So we get the same type of depolarization happening. A little bit more complex. We're not going to go into it now. We're going to go into it when we discuss muscles. But there's a whole series of reactions that will take place to cause the muscle cell to shorten. That's going to change proteins within the cell and cause them to shorten. And what's that going to cause the muscle to do? Shorten or contract. So we see an action potential that arrives. Again, calcium is involved in the axon end bulb to help release neurotransmitter. You know all this from your discussion of neurons. If you don't know all this, you will by next week when you have to take your test. Yes? And where can you go see this stuff that you should have already been seeing several times already? Who? Yeah, mastering interactive physiology. Yes? Okay. So we release neurotransmitter. It comes in contact with the receptors. They open up, sodium rushes in. What degrades acetylcholine? Nope. Acetylcholine ester ACE. That big, huge word down there. If we didn't degrade it, it would just keep firing off, correct? Until what happened? It would be too low in number. It would diffuse away. So we either break it down, well, we do both. Break it down and let it diffuse away. Oh, take out your clicker again. So a physician can determine the approximate location of a spinal injury simply by testing areas of the skin for numbness. These skin areas are referred to as pardon me. 5, 4, 3, 2, 1. Oh, we got 39 now. What's the answer? Dermatomes. Very good. So, innervation of visceral muscles. What's a visceral muscle? The internal organs and glands. So autonomic. I don't do these things. I don't think about them, I'm conscious of them, make them happen. So when you think viscera and glandular secretions innervated by the nervous system, think automatic or autonomic. Branches form synapses via the varicosities. And these are sort of little groups that we can see in, oh, they don't have a diagram of it. Don't worry about it. Acetylcholine, norepinephrine act indirectly. We call them second messengers. And visceral motor responses slower than somatic responses. So when we talk about visceral action, it's going to happen much slower than motor, conscious motor, skeletal motor actions. Oh, yeah, there we go. Let's see that in your book, though. So these, for some reason, are not in your book. I think it's under smooth muscle somewhere. But we can see these little groups of neurons, part of the autonomic nervous system called varicosities. So, cerebellum, basal nuclei, these guys are the levels of motor control. Ultimate planners, they coordinate complex motor activities. And 3 different areas, segmental, projection, and pre-command areas are going to help control these levels. We see this diagram on page 512 in your textbook. So pre-command highest levels, cerebellum, basal nuclei. Projection levels is getting information there. Motor cortex, spinal cord. Segmental level, that's the lowest level. So spinal cord, when we're talking central nervous system, contains different central pattern generators. We see sensory input and motor input, and the coordination of both by these 3 levels. So segmental level is the lowest level in this hierarchy of motor information. Central pattern generators, different circuits, networks of the ventral horn neurons. And ventral is what? Ventral is motor. Dorsal is sensory. They control motor movement, locomotion. Projection levels, upper motor neurons, so bringing information from upper regions. Brainstem motor areas that oversee indirect or extrapyramidal system to control reflexes. Projection motor pathways. Oops, my little thingy's in the way. Send information to lower motor neurons and keep higher command levels informed of what's happening. So it's kind of the go-between between lower and higher regions. Oops. And then pre-command. Pre-command regulation of motor activities. And again, these are higher up in the brain region, cerebellum, basal nuclei. They're going to help regulate motor activity and monitor what's going on. So these are the file cabinet regions of the 3 hierarchical levels. Cerebellum, important coordinator. So acts on different motor pathways through projection areas of the brain and the motor cortex via the thalamus to fine-tune those activities, movements of large muscle groups coordinatedly. Basal nuclei is going to inhibit various motor centers under resting conditions. This is what helps you slow everything down. Let me see that again. So we see some of these different levels mapped out for us in the brain in figure 13.14 on page 512. What's a reflex? Yeah, it's not really automatic, but it's really, really fast. It's a response before the perception. Reflexes are going to involve processing that happens right in the spinal cord so that motor messages can be sent out very quickly. Remember, that doesn't mean we're not conscious of what we're doing. It means that we do it before we're conscious of it. Does that make sense? And what are reflexes for? Yeah, some of them test the integrity of the central nervous system, and some of them actually protect us from harm. We already talked about some of the components of a reflex arc in part 4 of the book. Page 513 talks about some of the different pathways. They happen very rapidly, involuntarily almost. Predictable motor response to certain stimuli. So believe it or not, you sitting here maintaining posture is a reflex. It also helps to control some visceral activities. Because remember, we have to cause muscles to contract. in order to perform these different functions. Can be modified by learning and conscious effort. When I tell you stand up straight, what do? You do the same thing you were just doing unconsciously, consciously, yes? That's what that means. So learned or acquired reflexes result from practice or repetition. So I can cause things to happen what seems like automatically by repeating an action over and over and over again, like driving a car, like typing, like playing a piano. You have to learn those things, correct? They don't just come naturally. But now it seems like they happen effortlessly sometimes, like speech. So, reflex arc contains the same basic components no matter what reflex we're talking about. You should know those components and be able to label them. So we have some sort of receptor receiving information. Is this sensory or motor? Yep. So the next sensory information has to be delivered by some sort of what? Sensory neuron. So when light comes in, I have a receptor that I'm going to hand off to what? A sensory neuron. So sensory neuron is going to bring that information where? To the central nervous system. Then there's a handoff guy, and that's going to happen in the integration center, which is typically located where? What part of the central nervous system? Where is that? Think if it's coming from here. Where would that integration center be? If I put my hand to something hot, information's coming in from here. Yeah, it's in the spinal cord. I'm eventually going to be aware of it with the help of the integration center, but it's in the spinal cord. Integration center or interneuron is going to hand off information to who's next in the reflex line? Motor groups. Motor neuron's going to bring information where? Nope. Motor is out, right? So information to the effector. Effector, in the case of me pulling my hands away from something hot, would be what? Would be some groups of muscles to cause me to pull my hand away from that something hot. So the effector in the case, typically in the case of a reflex arc, is some sort of muscle group. So know the components of a reflex arc, the pathway that neurons travel. Some sort of receptor, sensory neuron brings information to the spinal cord. Interneuron's going to do two things. Hand off to motor neuron with respect to the reflex arc. But who else is going to hand off to? Because I'm aware of that heat and me pulling my hand away after it's done. So where else does information have to go? Up to the brain for processing, right? So the interneuron's going to do that as well, or the integration center. While it hands off to motor, it's also going to hand off to ascending pathways which run up the spinal column. Everybody with me? Good. So you'll see that someplace again. Know the order in which message is sent during a reflex. So different classifications of reflexes. We can have things called somatic reflexes, and we can have autonomic reflexes. Soma means what? Body. So when I think body, think skeletal muscles. So activating skeletal muscles. That reflex that I just described to you is a somatic reflex. What's that mean? I moved some skeletal muscle to get it done. And we also have autonomic or visceral reflexes. That's more things we don't have control over, correct? Not that we really have control over a reflex either. But what are we innervating with respect to an autonomic or visceral reflex? Those automatic, smooth muscle, cardiac muscle, or some kind of gland. So we can have spinal somatic reflexes that, again, bring information, integrate, and affect skeletal muscles. When I look at reflexes, why do you think your doctor tests your reflexes? To see if there's any damage to your central nervous system, because you're directly testing what? Integration centers in the spinal cord. So, smoothly coordinate stretch and tendon reflexes are going to help coordinate muscle movements. We see information being sent from tendons. And what's a tendon? Attaches a muscle to a bone. What's a ligament? Bone to bone. Okay? So we're going to find little receptors in tendons that attach muscles to bones. They give us information about the length of muscles, the amount of tension on muscles, and those reflexes are going to help coordinate things like posture. Functional anatomy of some different receptors we're also going to find within muscles called muscle spindles. So we have tendon reflexes, stretch reflexes, muscle spindle reflexes. And again, these are groups of neurons associated with different groups of muscle fibers. We have something called an interfusal fiber. And they lack myofilaments. Myofilaments, we're going to talk muscle, are groups of proteins that are going to cause a muscle to shorten and lengthen. So I'm not going to get crazy about this because we really haven't talked muscle yet. So you can kind of put a big X through that part of your outline. Be familiar with tendon spindles, muscle spindles. The terms should be familiar, and they're pretty self-explanatory, so it's not something you're going to have to sit down and memorize. If you look on page 515 in your textbook, figure 13.14, we see a picture of where some of these guys are located. And again, you find them within muscle groups or within the tendons themselves. They're going to help give information about how muscles contract. In order to create movement, we don't only have to have muscle contraction. Did you know that? When I make this movement here, do all the muscles involved in this movement contract? No. Some of them do what? Some of them get longer. They stretch. So these guys, muscle spindles, are involved in not only the contraction, but the stretch reflex, causing muscles to get longer. External stretch of muscles and muscle spindles are what these guys are responsible for. And stretch reflexes can also be tested as well. When you have your labs on the nervous system, you'll do some testing of reflexes. So you get to see these guys in action. You'll see how some of them cause stretching and contraction. So stretch activates muscle spindles, causing muscles to stretch rather than contract. Again, I'm not going to get crazy about this. Different reflexes, different movements involve stretch and contraction. So that's basically what this is discussing. Don't worry about that. We get all kinds of crazy there. And then we have a nice picture of some of the pathways that we see of some of the nerve impulses involved in the movement-related reflexes. Page 516, figure 13.18 shows us some of the different innervation of the nervous system in a stretch reflex. So some muscles contract and some muscles lengthen. Again, I'm not going to make you memorize this. Just basic information about reflexes. Okay, understand that certain reflexes involve stretch and contraction. Okay, so patellar reflex, you're all familiar with that one. That's where the doctor whacks you on the knee with a hammer, right? Is there a stretch and a contraction involved here? Yes. So we're going to see it's a same-sided reaction involving muscles in the upper leg, quadriceps, and hamstring muscles underneath. Some stretch, some contract. So we see the patellar reflex. Tendon reflex. And that's on page 517 in your textbook. Again, getting information from tendons produces different lengthening and shortening of different muscle groups. Sometimes a contracting muscle has to relax so that another muscle can cause the movement. That is the one that's the opposite of the one that you are involved in, and sometimes referred to as something called an antagonist. So doing the opposite. So quadriceps strongly contract, tendon organs are activated, we send information to the spinal cord, and then we cause two pathways of information to leave the spinal cord. One impulse with a stretch tendon is dampened, and then the antagonist muscle causes it to contract. So sometimes they work not really against each other, but do the opposite in a movement. If they didn't do that, the movement wouldn't be able to happen. Does that make sense? Then sometimes we have information that actually crosses over in the spinal column. These are flexor and crossed extensor reflexes. We see this on page 518, figure 13.20. Some information keeps on the same side, some information crosses over when we talk about a crossed extensor reflex. So this is again within the spinal cord, and we see the action here. So if someone grabs one side of your body, you might react with the other side of your body in a crossed extensor reflex. So information is sent to both sides of your body, the same side of the action possibly, and crosses over to cause an action on the other side of your body. That makes sense. Crossed extensor. Yes? Everybody's like, yeah, no, none of that stuff. All right. Superficial reflexes from the cutaneous system. Plantar and abdominal reflexes are ones that we test all the time, especially in newborns. Anybody work with little ones? The Babinski sign? All of these are reflexes. It's testing to see the integrity of the central nervous system. You're going to see different actions depending on the age of your patient versus when I stroke the underside of your foot. When you stroke the underside of your foot, what are you going to do as an adult? Huh? Do you know? Yeah, your toes are going to go like this. What's a baby going to do? Like that. What if the baby goes like that? It's broken. So these are reflexes that are very common and tested quite a bit to see the integrity of the central nervous system. Plantar reflexes, testing integrity of L4 to S2. Again, they describe the Babinski sign. Damage to the motor cortex or the corticospinal tracts give an abnormal Babinski sign. Now, normal in infants, less than 1, due to what? Incomplete myelination. So adults shouldn't be doing that. Superficial reflexes, abdominal reflexes. Again, test T8 through T12. And don't worry about developmental aspects. And we're done with chapter 13. Yay! Now, the autonomic nervous system is one of those really ridiculous chapters that they kind of already talk about in the peripheral nervous system. So there's only a few things to be said on Thursday about that chapter. You can see it's very short too, compared to all the other chapters. So we will finish chapter 14 on Thursday. We will have our exam on chapters 11, 12, 13, and 14. When? Tuesday of next week. Okay? Is everybody signed?